Joining us now to talk about COVID is Dr. Jacob Prunuske. He has a practice at the Esperanza Family Medicine Clinic, and he's professor of family and community medicine at the Medical College of Wisconsin. Thank you so much for being with us here on BNC, Doctor. The Biden administration, they've launched this website that I just gave out, wanting Americans to order 4 rapid tests to be shipped to their homes for free. The first tests are expected to ship later this month. What do you think people need to know about properly taking these tests at home?
Yeah, I'm really excited about the availability of this test. I think it's going to fill a big need for a lot of people. I think people will have questions. When do I use the test and how do I use the test? The how to use the test, follow the instructions in the box or ask for help from your family doctor if you're uncertain. The when to use the test, I think the most value comes in testing before big public gatherings. So if you have a family or school event, are considering a music festival, a convention, a business meeting, going to a sporting event, the test could provide you information about whether or not you might have COVID-19, even if you don't have symptoms.
So people are going to be doing this at home. Do you really trust them to do it correctly? Because, people have trouble just, opening a jar of jam sometimes. I mean, not to, say people aren't smart enough, but I mean, you're talking about testing for COVID. And I remember when testing first started, and we used to show all this video of doctors and nurses putting this really long Q-tip looking thing up people's nose, and they were just squirming. And what are we looking at here with these home tests?
So these tests are going to be easier than that. It does require collecting a nasal specimen, although there are some saliva specimen tests that also exist. And the testing itself is similar to doing a home pregnancy test, which many people have done before. You collect the specimen as it says and follow the test instructions, and within a short number of minutes should have results.
All those people that got that really horrifying long thing down their nose are probably upset that this new test is so easy, but we're happy about that. Listen, doctor, can these tests actually detect all of the COVID variants that are emerging because we have the Delta, we have the Omicron, we have the combination Delta and Omicron. Can it detect all of those things?
Yes, so far the answer is absolutely yes. Obviously, new variants continue to emerge, and until we get the entire world vaccinated and the pandemic switches to endemic, there's a risk that something will change. But at the moment, these tests are excellent at testing COVID or testing and detecting for COVID infection.
That is so good to hear. So if you take the test at home and your test unfortunately comes back positive, what do you need to do?
Yeah, so a positive test result means that the test found the virus and that person's probably infected with COVID. They should stay at home or isolate. They should wear a mask and avoid public gatherings where they could transmit the virus to someone else. If they are not having any symptoms at all, follow their return to work or return to school policies. And obviously, if they're having symptoms or their health is worsening, they should call their family doctor or seek other health care.
All right, so we're talking about masks here being very important as well. The White House is also making 400 million N95 masks available for free to the public. That's going to start next week. What do people know about these masks? What do they need to know? Because a lot of people say they're just not comfortable wearing them. They're still hesitant. What do you want people to know about these type of masks?
That this type of mask, an N95 mask, is the most effective at preventing transmission of COVID.
And how long do you wear it? How do you know it's
Yes.
effective? Is there a way to know it's
Mhm.
effective?
So no mask is 100% effective, but this is the best mask that we have available today. It reduces risk. It doesn't make the risk zero. That's why the other measures like getting vaccinated, physical distance, and hand washing are still important, even with the masks. I think when wearing the mask, the most important thing is to make sure it has a good fit or a good seal around your face and fully covers both your mouth and nose.
Yeah, oftentimes you see people wearing the mask, but it's pulled down on their mouth. Why is that not helping them?
Well, you can still breathe out through your nose, and if you had COVID, you could spread or transmit the virus that way. And as you breathe in through your nose, the mask obviously isn't protecting you from the air that you breathe in. So the best use of the mask is to have it fully covering both mouth and nose, both to protect you and to prevent you from potentially harming other people.
Yeah, I'm not sure why. I still see so many people with the mask pulled down over their mouth. So thank you for walking us through the proper use of that and why it's also important. We appreciate your time here, Dr. Prunuske. Thanks so much for joining us here on BNC.